So,
Thank you.
well, let's just start with the concern of where the healthcare sector is right now, and we're talking about public healthcare more than anything in South Africa, and what the major concerns are for medical schemes.
Medical schemes are concerned that NHI on its own will not be the solution to South Africa's healthcare problems. It needs to be a total overhaul of the system, looking at the managerial problems currently faced by government. There are also other issues like distribution of pharmaceuticals, also improvement in working conditions needed before they believe it can be implemented successfully. Certain of the medical schemes are, however, very ambitious and do believe that public-private partnerships can play a role going forward.
Well, if the NHI were to come into full effect, how would that impact medical schemes?
Medical schemes will probably play less in the primary care market, and they'll need to refocus their product offerings to specific needs of the population at that stage. Medical schemes do, however, believe that there are opportunities for them to play in that field going forward.
But because what would happen? I mean, ideally, I would imagine what the government is trying to do is have this blanket insurance that everybody has got access to, everybody can get quality health care. But looking at where the state of public healthcare is right now and where the state of private healthcare is it possible to have a happy middle with regard to what the situation is looking like right now?
Medical schemes believe there could be. They do believe that a two-tier system could work. They also do believe that if government implements policy correctly and allocates the necessary resources, then it could succeed.
I have to ask you this. Right now, the medical schemes, where do they think the problem is? Is the problem in public healthcare with funding, or is the problem with management?
There were strong views around the management factor.
So if we talk about that, if more money is going to come into the system, because essentially that's what the NHI is, more money into the system, will it mean that we'll perhaps have better care if right now the issue is management? Should that not be dealt with first?
Yes, that's certainly the view of nearly all the participants to the survey, that managerial problems should be addressed first.
Now, for people that are, and I was saying to you that, that some people can afford very, very good medical aid here in South Africa, and yet you still find that once you've paid your benefits, you still have to sometimes, pay that extra. So does that person really want to having to pay extra on their own healthcare and then having to pay for somebody else?
The problem we're currently facing is actually twofold. The one is there's no national tariff system for the supply of medical services. That results in providers, of course, charging certain rates for their services. Now, medical schemes need to provide prescribed minimum benefits in terms of the current Act. These prescribed minimum benefits must be paid in full, which if a medical scheme needs to cover this, it will immediately be built in as a cost in their pricing. And that makes medical cover more expensive.
I want to talk a little bit about the cost of healthcare, and I don't think it's just here in South Africa. I think the cost of healthcare is very expensive across the globe. In terms of affordability, do you think that you have talked about having a national tariff? Is that something that South Africa should probably be looking into?
The Competition Commission is looking at the cost of healthcare, or they indicated they would like to do a full investigation into the cost of healthcare, so that could assist. Then we've also got the regulator coming with regulations around demarcation, and that is where can medical schemes play and where can insurers be in the environment. Now, we know that medical schemes cannot risk rate, whereas insurers can risk rate, and insurers can in a way offer a lot of the cover cheaper than what a medical scheme will be able to cover. So that's still a heated debate that will probably only be finalized within next year.
What would that mean though for the business models? I would imagine that they have to start, I mean even now already, that medical schemes will have to already start changing the way that they plan to operate going forward.
Medical schemes are probably in a phase of scenario modeling, where they don't know what the full outcome is going to be of NHI and of other regulatory changes. So they need to consider various outcomes and then model where they would fit into that space going forward.
Doesn't that make it difficult to plan for the future though, not knowing where you are?
It certainly makes it very difficult for medical schemes.
And so in the environment that they're having to operate in now, it does seem as though it's such a challenge to just know what's coming tomorrow, what's coming in the next 5 years, what's coming in the next 10 years. So what are you advising with all that you're seeing and in the study that you've done with the scheme that you're speaking to? What are you seeing in terms of how they're planning to prepare?
Many of the medical schemes actually commented that they cannot prepare yet because they don't know where to start with all these changes that's happening. Certainly they are looking at restructuring some of their products going forward. And also they are taking part in the debates around NHI and the regulatory environment.
So let's talk about, you had talked about, opportunities that still remain. How positive or how lucrative are these opportunities should the NHI come into effect?
Most of the medical schemes in the survey indicated that they believe that there's a lot of opportunities for them to play in this space. So they're very positive.
Thank you so much for joining us, Ilse.
Okay, thank you.
That was Ilse French, and she's principal of the latest survey on South Africa's medical schemes industry. She's PwC's medical schemes leader for Southern Africa.